I'm excited to be presenting our team's new work titled Enhancing Surgical Precision in Autonomous Incisions via Physics-Based Tissue Cutting Simulation. In this work, we present a novel physics-based tissue cutting simulation that accurately models the material deformation seen during a soft tissue incision. To the left is a video of a real-world incision on a porcine tongue, and to the right is video of a simulated incision on a porcine tongue. Notice the tissue deformation that happens during both procedures. Surgical tissue cutting is an important part of many treatments, such as tumor resection. In tumor resection, cutting accuracy is paramount, as incorrect resection margins can increase the probability of cancer recurrence or reduce patient quality of life. Robot-assisted surgery is the current clinical standard of care for tumor resections, and recent research has demonstrated the viability of autonomous surgical robotic systems for tumor resection, which can perform surgeries to a greater degree of accuracy. However, tool-tissue interactions during a surgical procedure induce tissue deformation that is difficult for a robot to compensate for. To address this, we built our physics-based tissue cutting simulation that preoperatively predicts tissue deformation for tool trajectory improvement. For our work, we use porcine tongues for real tissue experiments due to their anatomical similarity with human tongues. We mimic a glossectomy setup, or a surgical resection of a tongue tumor. Tumor edges taken from clinical records are used, and a 5mm safety margin is added for our desired incision path. A robotic arm with electrosurgical tool attachment is used for the incisions. Our real to sim to real workflow is as follows. We performed initial robotic experiments on the tongue samples with varying electrocautery voltage and tool speed to analyze the tissue deformation and incision precision. These initial experiments informed the creation of a physics-based tissue cutting simulation in Simulation Open Framework Architecture, or SOFA. The same porcine tongues were imported as volumetric mesh objects into the simulations, and the simulation parameters were optimized to match the previously seen tissue deformation. Next, new porcine tongue models were imported into the simulation, and tool path refinement was performed by analyzing cutting precision on repeated simulated tissue incisions. Finally, the improved tool paths were exported back to the real world for execution on our robotic system. To the right is a video playing of one of the simulation improved incisions in the real world. We assessed our results by measuring the absolute average incision accuracy as well as using the who moment to evaluate how close the incision shape was to the intended incision shape. We found that the robotic incisions following simulation improved paths reduced average absolute incision error and better respected the 5mm safety margin around the tumor edge, providing a safer clinical outcome for the intended patient. It is worth noting that one of our specimens failed to have the incision accuracy improved in simulation as expected and saw worse incision accuracy in the real world. Here are the references we used for this presentation. We would like to thank our collaborators in the Immerse Lab, as well as our collaborators at Johns Hopkins. We would also like to thank the funding agencies that generously funded this work.